All right, let's go ahead and get started then. Welcome, everybody. Thanks for joining us for World Catholicism Week on Catholicism and healthcare around the globe. It's been a rich feast so far this morning. One of the questions that was raised in the last session was the question of what makes Catholic healthcare Catholic. And I think, at least in part, one of the answers to that question has to come from what we'll be talking about during this session, which is biblical and theological narratives of health and healing. We see Jesus as healer in the Gospels, and there's many, many stories of healing in the Bible. And in the theological tradition as well. So that will be the topic of the panel this afternoon. And we have three very distinguished and provocative speakers with us this afternoon. I'll introduce them one at a time. So we'll start with our first speaker, who is Alex Martins, who comes to us from up north, Marquette University. Alex is from Brazil, a theologian and bioethicist, but he got his PhD at Marquette and has been teaching on the faculty at Marquette now for a few years, yet to acclimate himself to northern weather, but still working on it, as he said yesterday. He's a member of the core leadership of the Catholic Theological Ethics in the World Church. He has a degree, postdoctoral degree in democracy and human rights from the Human Rights Center at the University of Coimbra Law School in Portugal, and he's published widely in global healthcare, including his book, The Cry of the Poor, Liberation, Ethics, and Justice in Healthcare, and many articles besides that, and many much experience. He doesn't write about these matters just as a theoretician, but as a practitioner as well. We had a session with students yesterday, and some of the students had done research on various topics. One of them had done his research on Alex. One of them had done her research on curanderos, and Alex said that his grandfather had been a curandero. One of them did research on Paul Farmer and Gustavo Gutierrez, and Alex said that he knows them both and has spent time with them both, with Paul Farmer in Haiti. And the fourth student had done work on the Uganda Catholic Medical Bureau, and Alex had spent a couple of months in Uganda working with the church and healthcare there as well. So please join me in welcoming Alex Martins.
Thank you very much, Bill, for that warm welcome and that very nice words, and give a little bit about my life, the good part of my life. There is the dark part too. we keep that for another opportunity. So, and I'm very glad and honored to be here in this conference. I remember when I was a PhD student, I came to DePaul to attend that just same week conference 2 years ago, and now it's very good to be back as a speaker. So it's very meaningful for me. I really appreciate the invitation. Yesterday, I had a great time with the students, as you mentioned. Was for me nice to read the work and give some feedback and interact with them. So it's wonderful. And I enjoyed the talks this morning a lot as well. Seeing a speaker from Rwanda, the Jesuit father from India, and another Brazilian who speak this morning as well. I watched his talk, was wonderful. And my talk, I will start to share my screen here right now with my talk. I hope you all can see. And the subtitle of the title specific of my talk I named the centrality of the sick, the poor, and the oppressed in Jesus' mention. You see that nice draw that was a friend of mine. He did that picture based in a passage from the Gospel of Luke that I want to present today. So Bill mentioned that some of my work, but one of the books I published in the past in Portuguese is about Christology, Latin American Christology, as a resource for theological ethics. I wrote this book a few years ago, and I have to say here, and I get very involved in the global health world, and because that I have that common way to address that I put to you. Go to see the reality where the healthcare is needed. See how healthcare is delivered or could be delivered there. The local partners, the relation between poverty and healthcare, and then the Catholic social teaching to inform and all these actions and understand of the reality, especially from the preferential option for the poor. And I have to make like a self-criticism here, because many times when I do that, I forgot the theological source. I mean, not a theological source, but a biblical source for that Catholic work in healthcare. I identify this in the healthcare. It's a vicious cycles that I want to my work and my reflection to address that and break that cycle between poverty that lead people to be vulnerable to illness. When they get sick, no health care, yet create more suffering and lead many of those to a premature death. And from a perspective, I want to address that from a perspective that is from below. The preferential options for the poor guide us and guide the work I promote to that perspective that places the poor at the center of global health effort in order to break that vicious cycles. And that's in global health, it's, I would say, revolutionary, because most of the approaches have a top-down perspective, especially if you think about from big organizations. And I want to invert this for like a bottom-up perspective grounded in the Catholic social teaching. And here, what I was alluded before, the tendency of go directly to the pragmatic aspect of the social principles and their contribution to healthcare. And doing that many times is a self-criticism. I sometimes forget to go back to the biblical roots of this, the biblical grounds that give us all the elements for our work in global health. And this is I want to do right now is go to the ground, go to the biblical inspiration, the biblical source to inspire and to support all of our work in global health, all of work in healthcare. And I will present that 3 points for you. A biblical theological foundation of Catholic mission in global and public health, the integral healing meanings of Jesus based in Luke 4, that chapter from the book of Luke, and of course I will conclude. I hope I can do that. So, biblical theological foundations for Catholic mission and global health. We know very well that Jesus' historical healing mission. If you go to the Gospels, what you see most is Jesus have interaction with the sick, and most of them are poor, sick people. That are in all the four Gospels. I gave you 4 examples here where you can find Jesus healing the sick man, healing the people with skin disease, healing the women who have like a bleeding, and many other situations, even make miracle to revive his good friend Lazarus after death. So it's clear and objective. And the church continues this healing mission in history. I put here 2 mission statements from 2 Catholic health organizations in the United States. From Christos Health, they say our mission is to extend the healing ministry of Jesus Christ. Catholic Health Association say Catholic Health is a ministry of the Catholic Church to continue Jesus' missions of love and healing in the world today. We don't have doubt that the church has a role and a mission entrusted by Jesus in the context of healthcare. Because what Jesus did for the sick, but also because what Jesus taught us as the Good Samaritan parable when Jesus teach us to take care of our neighbor, or even in the Matthew 25 in the Last Judgment when Jesus said, "I was sick and you visit me." In the St. Camilla's saint of the church, he used to inspire in these 2 passages to say, "Take care for the sick. It's a privilege because in one hand you're like Jesus, the Good Samaritan who cares for the sick. And the other hand, the sick who is cared by you is also Jesus for you." It's just an amazing experience, according to St. Camillus, when you had the opportunity to take care of the sick. But I want to extend that vision of take care for the sick to understand how the preferential option for the poor, that is a Christological option, can help us to understand even deeper, our mission in healthcare. How the option for the poor, or the preferential option for the poor, that is an option that came from our faith in Jesus. For many years, or many people would say, when that option was developed, especially in my context in Latin America, people has criticized those who had promoted the option for the poor as this is a sociological option, and because that is very vulnerable to some questionable political theory. Okay, I will not very much respond to this question, to this criticism right now, but I want to say, most of all, the option for the poor is clear present in the ministry of Jesus. Is an option that came from Jesus. The Latin American bishops are very clear to say that the option for the poor is an option for a Christological faith. They say that in the document of Aparecida, and Pope Francis called this in the Evangelio Gaudium. Remember that the option for the poor is an option that comes from our faith in Jesus more than anything else. In addition, Pope Francis helped to develop this option for the poor. In the Laudato Si, he said the option for the poor is in fact an ethical imperative essential for effectively attain the common good. And I think that it's very deep. The option for the poor come from our faith in Jesus, come from the heart of the gospel and Jesus' ministry for the sick and for the poor. At the same time, the option for the poor as an ethical imperative became a key principle to help us to attain the common good. And this here, it's important because I want us to reflect, what does attain the common good means in this health and well-being context? What Francis mean about this? How preferential option for the poor as an ethical imperative that came from our Christological faith help us to attain the common good. The preferential option for the poor shows that continue the ministry of Jesus is also fight against a system and its structures responsible for create poverty and oppression that make the poor make people vulnerable to get ill and die prematurely. Because of the lack of good living condition opportunities, and access to healthcare. All those elements, living conditions, opportunities, access to healthcare, are elements from the common good that the preferential option for the poor help us to attain. This is a prophetic ministry. Jesus' ministry for the sick, subsequently, the ministry of the church that continue that ministry of Jesus is prophetic because it provides a comprehensive perspective to care for the sick that include the option for the poor and liberation from oppression for the year acceptable of the Lord, a jubilee year where all can attain the common good. And probably if we are hearing me, you said, what do you mean about year acceptable to the Lord? Let's understand this now, doing a little bit of biblical exegesis, understand how this mission that I just present to you is not something I'm creating from my mind. It's not something that a Catholic organization, a church creates from its own desire, but comes from the gospel. And I will use to show that not a traditional passage, Jesus caring for the sick, but this passage from Luke 4:16 to 30. And I want to read here that passage for you. Please, I want to read with me and then have like a few seconds just for us to meditate a little bit this passage. He came to Nazareth, where he had been brought up, and went into the synagogue on the Sabbath day as he usually did. He stood up to read, and they handed him the scroll of the prophet Isaiah. Unrolling the scroll, he found the place where is written, "The Spirit of the Lord is on me. He has anointed me to bring the good news to the poor, to proclaim liberty to the captives, to sign to the blind, to free the oppressed, to proclaim the year acceptable of the Lord." Then he rolled up the scroll, gave it back to the assistant, and sat down. And all eyes in the synagogue were fixed on him. Then he began to speak to them. "This text is being fulfilled today, even while you are listening." So, this passage of Luke 4, it's a part of a literary block in the Gospel of Luke named the Galilean ministry from chapter 4 to chapter 9. This specifically pericope in chapter 4, Jesus in the synagogue of Nazareth, that you have a parallel passage in the other two synoptic gospels, but very, very short. They don't have the details and the drama and everything that happened in the Gospel of Luke. It's very interesting to understand when you see the Gospel of Luke, how the work of editing, the author of the Gospel, the community behind his Gospel, they added a lot to his piece. That means they have a source that Mark and Matthew didn't have, or they just create those details that actually historically maybe didn't actually happen. But it's interesting because the author of the gospel, they use the Greek text of the Old Testament, the Septuagint, not the Hebrew text. And that's very interesting. And they do even the author even added Isaiah with to use some verses from chapter 61 and chapter 58 to put together. They cut those elements you can see to smooth the broken heart, the day of the vengeance of the God, to add, to free the oppressed, and to conclude with proclaim the year acceptable of the Lord. When you read that passage, you can see the author, he didn't do that by chance. There is a purpose to show the ministry of Jesus, what the ministry of Jesus means. And if you can see literally, I know I am not a biblical scholar, but I like to do those kind of exercise. If you see those, when you read the gospel in Greek, you see those words, aphese, dikanon, is words of movement, give some kind of like a literary movement that show like to free, to acceptable, that to free the action of the Messiah who came to free the oppressed, it to acceptable, something very that the Jewish audience know, referring to the Jubilee year. So the meaning of the addictions quoted from Isaiah is better understood, especially at the conclude of the passage. You say, this text is being fulfilled today. That show Jesus is the Messiah, came to free the oppressed. Jesus is the Messiah who came to proclaim the Jubilee year, the year acceptable to the God. And it's the most interesting because if you see the gospel start, this Messiah is anointed by the Spirit. The once was revealed in the baptism in Jordan before. The Gospel of Luke trying to show every action of Jesus are actions under the assistance of the Spirit, of the Holy Spirit. And the year of the acceptable year of the Lord is an inauguration of a new age, a time announced by the prophets. And Jesus, this one that the prophets has talked about to do what the prophets announced the Messiahs will do. So when you see that, you understand the core of Jesus' ministry. I see that passage as like a agenda, the platform of Jesus' mission that include what's the Jesus ministry in the gospel, to bring the good news to the poor. The poor is a privileged recipient of the gospels. From that came our preferential option for the poor as a Christological faith. The mission of Jesus, the ministry, to proclaim liberty to the captives, giving new opportunities and freedom for those who made something wrong. That is mercy. A key aspect of the Gospel of Luke is Luke that you have the parable of the prodigal son or the merciful father, for example, to sign to the blind, heal the sick and the disabled, to free the oppressed, promoting liberation from oppression, to proclaim the year acceptable to the Lord, build a new time in a new society based in God's justice. So those elements are Jesus' ministry. And then when you go to see all Jesus' ministry, especially the Galilee ministry, Jesus did exactly what is said in the beginning of the chapter 4. So then the church continues this mission. That is the great aspect and the beautiful of this passage. The mission of the Catholic Church is to continue the healing ministry of Jesus. This mission is not limited to care for those who are sick, but also this care should include embrace a prophetic praxis that includes the poor towards attain the common good that Francis told us and I mentioned before. Free them from oppression, from structures that create oppressions. In other words, break this vicious cycle created by poverty, illness, no health care, more suffering, and premature death. The ministry of the church is take care of the sick that's in front of me, but also be attentive to break what create that impoverished sick person, so people can attain the common good. So bring the good news to the poor and proclaim the year acceptable to the Lord in healthcare include to care for the sick, to free the oppression, integral liberation, or as Pope Paul VI, Saint Paul VI, should be a promotion of an integral development. The truth from the Christological faith, then I'm trying to present that Christological foundation for our work in healthcare, that Luke revealed to us Jesus is anointed by the Spirit to lead the mission entrusted by the Father. It's very beautiful that just passage reveal what you call the joint mission between the Word, Jesus, and the Spirit in communion with the Father. And then you have the whole Trinity ministry operating here. In this mission, the poor are the privileged recipients of the good news. So the church continued this mission. They continue in history the work of Jesus under the guidance of the same Spirit that who guided Jesus. So the church learned the mission of Jesus to continue his work that is entrusted by the Father to us, church, to continue people of God, and we do that work guided by the Holy Spirit. I think that it's beautiful and so a source of spirituality and encouragement to lead us to work in healthcare to continue the mission of the church. Announcing the gospel of liberation, the good news to the poor, was a central part of Jesus' ministry. Within the liberating gospel, the healing of the sick occurred with no contradiction between praxis and medical care and work praxis for just in healthcare, but rather complementary. They complement each other. Luke 4 revealed the pivotal event that provides a Christology that unifies all interconnect aspects of Christian life and the church's mission and history to bring the good news to the poor, care for the sick, free the oppressed, and build a new reality effective attain the common good. And then here is my conclusion. The healing ministry of Jesus is a ministry of care for the sick and liberation, in which the poor attain the common good. If I work in healthcare, continue the mission of Jesus, I have to care for the sick and at the same time care for society, to create opportunities for the poor, for everyone attain the common good. Care for the sick and the oppressed and the poor is part of mission of Jesus' disciples, also guided by the Holy Spirit in a project of integral development. And with that, I end my presentation. Thank you. I will stop here sharing my screen. Thank you very much for the opportunities and to present that beautiful and very inspiring mission that comes from the gospel.
Well, thank you, Alex. That was terrific. That was beautiful and inspiring and really provides the groundwork for the rest of the session and really for the conference in a lot of ways. This is the reason that we're here. So thank you so much for that. We'll look forward to talking more about that in the Q&A session. So now I'm going to introduce our next speaker, David Toole. And David is Associate Professor of the Practice of Theology, Ethics, and Global Health at the Duke Global Health Institute and has a joint appointment in the Divinity School as well at Duke. And that's where I met David many, many years ago. We were both in the PhD program at Duke together. His dissertation became his first book, which is a really interesting, terrific book called Waiting for Godot in Sarajevo, Theological Reflections on Nihilism, Tragedy, and Apocalypse. And David's work has in some ways taken a turn since that early part of his career towards health. And he now teaches global health as a moral enterprise, global health systems, ethical dimensions of environmental policy, and so on. But it might be interesting to see what are the continuities between this kind of early emphasis on apocalypticism and this turn towards health. He's working on a book right now called What Are People For? Questions Concerning What It Means to Be Human. But he's also done a lot of work on missionary hospitals in Africa. And that, in fact, is the last time that we met in person. I didn't know that we were going to meet, but we ran into each other in Entebbe in Uganda, where David was recuperating at the house of a mutual friend from a very serious illness that he got while working in Africa. And that is, I think, a good segue to the topic of his talk this afternoon, the morgue in the Garden of Eden, what are hospitals for? So David, please take it away.
Okay, thank you, Bill. Thanks for the introduction and thanks for the invitation to be part of this conference. And before I forget, and it might be my only chance, thanks also to Karen and Marlon and Michael and perhaps others that I haven't encountered who have made all this possible, especially in the world of COVID. So I appreciate all that. Actually, Bill, it was 30 years ago, I hate to say, that we first met in the PhD program at Duke. So I'm going to share my screen. Yes, 30 years ago.
Yeah, I was 8 years old at the time.
I'm going to share my screen, and I always feel like, I mean, I want to give thanks to Alex too for warming people up. And then I always feel with the talks I give, like it's fairly inevitable that I need to say something in a Monty Python way of, and now for something completely different. So the title of my talk is The Morgue in the Garden of Eden. As advertised, it was What Are Hospitals For? I've changed the title to a case study on theological imagination, which I think will become clear as I move along. The talk will center, once I sort of get past some introductory things to seed your imaginations, on this hospital in Burundi, Rema Hospital, which was founded by Maggie Barankitsa, Catholic woman, Burundian woman, in 2008. And so I'm going to center my talk there. I could have called it A Tale of Two Morgues. So I first met Maggie and encountered Rema Hospital in 2009. And she toured us around her hometown of Ruwigi, showing us her new hospital, which at that time had just been open for a year. And then also on the tour, she showed us the government hospital, and her house actually sits right next to the government hospital. And on the tour, she showed us both of these morgues. So the one to the right going with the government hospital and the one below going with her hospital. And she made a big deal out of her morgue. And I have to say, this was my first trip to Africa. I was processing lots of things, not just this, but I didn't really understand what she was trying to say. And in many ways, certainly what I'm going to talk about today and things I've been thinking about and writing about since have come out of my encounter with Maggie and these two morgues. And so this is what I'm going to talk about, but I'm going to start somewhere else just to sort of get you all thinking in a larger way about the theme of my talk, which really has to do with the relationship between the dead and the living. So the quote at the top is from I think he's actually a Romance studies scholar, talking about the fact that if you really think about who we are as human beings, we are born from the dead, quite literally in lots of ways in terms of how we build our cultures and certainly our institutions. And he's of course being somewhat poetic and metaphorical, but there is a literal sense to this. So this is Çatalhöyük, which is the oldest or one of the oldest cities in the world that's been excavated by archaeologists about 9,000 years ago. So this is in South Central Turkey. It's essentially when humans were first starting to become the agricultural civilizational folks that we've become. And if you go inside the excavation of Çatalhöyük, you would see this. This is a picture from 2014. They built a tent over the top of this part of the excavation site. And what they've found as they've excavated down through the layers of this city, which was city, of course, being a relative term, we would think of it as a town now. as they went down through the layers in house after house after house, what they found was that all the houses were literally built upon the dead. So the holes you see to the right and then the close up on the left are the graves that are literally the foundations of the homes. And Robert Polk Harrison makes this point, that if you really think about who we are, it's almost as if we can't live without standing upon the dead and building everything that we build upon them. And again, I think that's somewhat metaphorical, but also literal. So I want to jump with that idea in mind and leading toward talking about Maggie and her hospital and her morgue to this scene. So this is the Church of San Pietro in Solferino, Italy. And inside, the church looks like this. So it's become an ossuary as a memorial to the dead. So those are all skulls. And up at the top, you see other sorts of skeletal remains. And the reason it's become a memorial for the dead is this. So this was Solferino in the background here on June 23rd, 1859, which was the day before the Battle of Solferino, depicted here by an artist, which was various European armies gathered on the battlefield for 9 hours, 300,000 soldiers. After 9 hours, there were about 7,000 dead, 20,000 wounded. And some of you may know the story. This is the scene that Henry Dunant came upon. And ultimately, it's because of what he saw on this battlefield that he created what we now know of as the Geneva Conventions and the International Committee of the Red Cross, which are, in a literal way, founded upon the dead, here again depicted in that ossuary. So there's this relationship, in this case, between the dead and the founding of moral institutions, the ICRC and the Geneva Conventions. That's the original Geneva Convention on the right. And now jumping forward to another scene, radically different in one sense, but not so much in the other. So this is the Nyamata Catholic Church in Rwanda, no longer functioning as a church, but now serving as the church in Solferino does as a memorial to the dead, this time not from a European battle over territory, but genocide. And in the back of the church is mass grave, or a series of mass graves. Some 45,000 people are buried in the mass graves behind this church. About 10,000 people were killed in this church, or in and around this church, over 6 or 7 days in April 1994. And just in front of all the mass graves is one of the most disturbing and powerful things I think one can do. You walk down a steep stairway into this room, through this room, and then out another stairway where you're walking through this ossuary with all of the bones not neatly ordered of the people who died in a genocide. And what's remarkable about both those stories to me is and that I want to pick up on now as I move to Burundi, is this relationship between the living and the dead, and the way, as Michael Barnett, a historian who's written a wonderful history of humanitarianism, says that, in so many ways we live at the service of the dead, but what they deserve is not just cemeteries, but moral institutions. Certainly the ICRC and the Geneva Conventions are moral institutions that were created in an attempt to live at the service of the dead. And so is the hospital that Maggie built. I don't have time today to go into Maggie's full story, so I will abbreviate it somewhat. But I'm trying to get at here is, again, the moral imagination, and in particular, the theological imagination that Maggie brought to the construction of her hospital. So the pictures here are of the same cemetery. The one at the top is the cemetery taken from the top of the cemetery looking down the hill. The one at the bottom is me at the bottom of the cemetery looking back up the hill. And you can see the date and the time there that I, thank the timestamps on photographs that I took it. And the people gathered there are my Duke colleagues, along with Maggie. And one of those colleagues is Emmanuel Katongole, who I know some of you know. And Emmanuel has written some wonderful stuff about Maggie and her work. And this was actually also Emmanuel's first encounter with Maggie. And what Maggie's doing as they gather around what is looks like a large tombstone is it's a monument on top of a mass grave. And she's telling us the story of how the mass grave came to be, and of all of the work that she started doing after she herself buried 72 bodies in that mass grave. So the day before, so she buried the bodies on October 25th. So on October 24th, 1993, she got caught up in the genocidal violence that was unfolding in Burundi about 6 months before the Rwandan genocide. Unlike Rwanda, where it lasted for 100 days, in Burundi, it turned into an ethnically charged civil war that went on for a dozen years. On the front end of that war, Maggie's village was wiped out. She and her 7 adopted children were not in the village at the time, and so thankfully they escaped. She then sought refuge in the compound of a Catholic bishop, which is just across the road behind those tall trees from this cemetery. She was there hiding for a couple days. She's a Tutsi. It was sort of marauding Hutu who had destroyed her village 2 days earlier, killing 60 members of her family. They were on a rampage because the Hutu president had been assassinated by the Tutsi military. So this is a similar story to what unfolded in Rwanda 6 months later, but with a somewhat different history. So Maggie was there. They came and wanted to kill all the Hutu in the compound. Maggie was a Tutsi. She tried to stop them. She knew some of the people who were coming to be killers and tried to talk them out of it. One of them was even a cousin of hers. They wouldn't listen to her. They saw her as a traitor. They stripped her naked, beat her up, tied her to a chair, and made her watch as they hacked 72 people to death. Somewhere in the midst of that chaos, Maggie was able to negotiate for the lives of 25 children, and her own 7 adopted children successfully hid away in the sanctuary in the church. So when it was all over and they untied her from the chair and left, she gathered up 25 children that she was able to save with her own 7 that she found miraculously had not been killed. And she left the compound, found refuge in the house of a German aid worker with these now 32 children in tow. And that was really the beginning. Maggie's visited Duke several times. I've toured her around and introduced her to lots of people. And she can never tell her own story of the great things she did without telling the story that I just told you, even if she does it in 2 sentences. You need to know that part of her story. But what came from that is amazing, imaginative stuff. So she built this organization called Maison Shalom. By the spring of 94, after 6 or 7 months, she had collected hundreds of Burundian orphans, not just the 32 that she started with. She then created this formal organization that was really dedicated to caring for the accruing orphans in Burundi. They were accruing because of the Civil War. They were also accruing because this was the peak of HIV/AIDS before ARVs. And so people were dying left and right, and Maggie was trying to collect the children. Over a number of years, 2-3 years into the story, things are always a little murky when you try to get Maggie to lock into a timeline. She now had thousands of orphans in her care, and she'd built 3 large orphan centers around the country. And then she crashed, and when she crashed, her work changed, or after she crashed, her work fundamentally changed. And I can't go into all the reasons that there was a change. But I'll just stick to the highlights. So one of the reasons she crashed, as she explains it, is the quote I have at the top here, is that she really felt after that trauma, and as she was gathering orphans and they were growing and she was going from hundreds to thousands, that she felt that it was her job to save all the orphans in Burundi. And she just couldn't do it. There were too many. The war was now raging. We're up to 1996 or so. It's been 2-3 years. And it was just too much. And the other thing that happened is that there was a similar massacre to the one she lived through in a town called Butezi, not too far from Uwigi. And she went to see the people after the massacre and found herself standing among the bodies of mutilated women, children, and also living mutilated children, some of whom she brought home with her. And it was just too much. That on top of the mental and physical stress of trying to care for all the orphans in Burundi threw into a crash. She lost the ability to speak, effectively to move. She ended up in a Carmelite monastery for a month. The nuns put her in a room, gave her a Bible, fed her, and Maggie pretty much just stayed in the room for a month, read the Bible, prayed, and tried to put herself back together. And when she came out of that experience, her description is that the revelation she had is that she'd made a mistake, that it was her job to try to do something out of her own forces, as she puts it, for all the orphans in Burundi, that actually the work was God's work. It was not her work. And she'd do what she could, but it was God's job. And that freed her to begin thinking differently. And one of the first things she did was build a swimming pool so that children could play. Now, this is where you really start to see Maggie working out of a theological imagination. So the site of the swimming pool that you see here was a mass grave. Just on the other side of that wall, which was not a wall at the time, was the government military camp. And as they would kill rebels, they would bring them here and throw them in this mass grave. Well, Maggie was aware of that and disturbed by it. And she was a woman of some means and had ability to find money when she needed it, which has remained true right to this day. And so she bought the lot that the mass grave was on, started thinking about what she could do to cleanse the place, at the same time that she was thinking about what she could do to give children a place to play, because she realized, against the protests of many, that you can feed children and clothe children all day long in the middle of a war. But the reality is you haven't turned them into human beings, which is what she wanted to do. And so they needed a place to play. And so she put all that together and she built a swimming pool. And when you ask her why, which I have, because I was mystified, because, you know, you could have built sandboxes and swing sets and they could have had a place to play. Her way of talking about it is to say, well, I figured that if I built a swimming pool where the mass grave had been, then it would be like the waters of baptism, and the waters would cleanse the mass grave and they would cleanse the children of the violence that they were living in, while I was also giving them a place to play. Now, not long after she built the swimming pool, right next door to it, she built the movie theater. She went to Paris, found an old theater, got the seats and the projector and everything donated. If you're inside this building, it looks exactly like you would expect of a movie theater. And then she showed the children movies, but also the adults and even the rebels and the government soldiers, because at this point, and now we're probably 4 years into the war, she realized that everybody had lost an imagination for any future whatsoever other than what they were living in, which was just violence and death. And so she wanted to try to prime their imagination in some other way. And she realized that maybe she could do that by showing them films. So she built this movie theater, invited everybody to come do it. And the first, I don't know the first movie she showed children. If she ever told me, I've forgotten, but the first movie she showed the adults was Romeo and Juliet, which you may remember in the midst of everything else is about a family feud. So she thought it was a quite appropriate movie to show a bunch of Hutus and Tutsis in the middle of a protracted civil war. Now, she built many other things that I can't go into: an organic farm, a vocational school, a library, on and on and on. She just kept building buildings. She changed her orphan model. So instead of 3 big orphan centers, she dismantled those and she started building houses in the home villages of the orphans and then putting them in artificial family units so that they raised themselves up in community. The houses belonged to them. It was a whole new model of thinking about how to care for orphans. But she also then started moving directly into what we would think of as healthcare in the narrow sense. And the first thing she did was built a maternal child center, which you see the insets there, give you a close up, and the blue arrow points to where it sits on this hill, Nyamatubo Hill. There's lots of important things in this particular picture. When we were driving there, she stopped to show us this and tell us this part of the story. So she built the maternal center because one day 16 newborn infants showed up on her doorstep. And she realized immediately that if 16 infants show up on my doorstep in a single day, then it means 16 mothers have died. So I have been doing things wrong in the sense that I've just been trying to care for orphans, but I'm going to care for orphans forever if I don't stop the supply. So I need to figure out how to stop orphans from being produced. And the way I need to do that is stop mothers from dying. So she built this maternal center. Now, she built the maternal center on the site where the government had its artillery batteries. Again, thinking, anywhere. It was true at the swimming pool and the mass grave. I'll tell you another story where it's true in a moment. anywhere she saw violence, she tried to put something where the violence was happening and turn it into life. This just became her sort of modus operandi. So that's the maternity center. Now, in time, the maternity center became the hospital that you see to the right. What's so dramatically amazing about that is that Nyamatubo Hill was the site of her family village that was destroyed in the first couple of days of the war back in 94 or 93. And the hospital is literally built on the top of her village. And I can still remember when we were first walking up to the entrance, there was a group of us, Emmanuel Katangale with us, and she was telling us this story. And we all had to stop and ask her to repeat what she just said, which was that it was built on the top of her family village. And she said, yes, I mean, quite intentionally, again, you know, put life on top of death. And she said, I'll show you where my mother's house is when we get inside the compound. Which brings us to the morgue. So as we were touring the hospital, she made a big deal out of the morgue, and she later took us to see the government morgue. When she did that, she showed us showing the government morgue. We were at her house because her house sits right next to the government morgue and the government hospital. And that was also intentional. The lot that she built her house on was a lot that could the lot for all of the garbage and medical refuse that the hospital was throwing out. And so she cleaned up the lot, got rid of all the medical refuse, sort of stopped their ability to just throw stuff there, and built her house. And then she built a chapel right next to her house, and right off the corner of that little ramshackle morgue that I showed you early on. And she would then go into the hospital and tell families that were there with people who are really sick, look, if they die, don't take them to the government morgue, bring them into my chapel, and I will show you how to care for them. And at this point, again, I can make it sound like I learned all these lessons in the moment, but it took me a while to put all this together. But in conversations with her over the years, what she explained is that what she'd realized at this point, and now we're 10 years into a protracted civil war, is that nobody was caring for the dead anymore. So the dead had become corpses in the street. You stepped over them, you ignored them, and so they just had no. The community had no sense of caring for the dead. And what she realized is that because they didn't know how to care for the dead, they also didn't know how to care for the living anymore. And that she realized that if she wanted people to care for the living, which is what her real goal was, she needed first to teach them to care for the dead. So when she built the hospital, she decided that the morgue needed to be one of the most important parts of the hospital. She caught lots of criticism for it. Because it was so expensive. I mean, this is a hospital whose central vocation was to care for mothers and children, with an emphasis on the children, since the mission of Maison Shalom, House of Peace, had always been to care for orphans and children. And yet she spent more on the morgue than she did on the pediatric unit, and people didn't understand. They also didn't understand when she built the swimming pool earlier on, because they just told her how many children she could feed and clothe with all the money she was wasting on a swimming pool. They said the same thing when she was wasting all this money on a morgue. But Maggie has a unique vision and would never let it go, as you see here in this quote. Now, it was true, building the hospital with the morgue in mind was true literally from the beginning. So here's Maggie talking with the architects about how she envisions building the hospital. So I don't want to build it right on the road. I want to build it back off the road so that when people come to the hospital, it's as if we're going up to Jerusalem, quoting the Psalm. And then I'm going to put the morgue here, and then I'm going to put the chapel there. And so everything, the very architecture of the hospital is arranged around the morgue. So here's the satellite view of Rhema Hospital, and the arrows sort of show you. So here's the road. Here you come in, going up to Jerusalem. Here's the main part of the hospital and the wards. And then if you go around the hospital, the morgue sits right here in the back. And then as you exit on this road, here's the chapel, and then here's the exit. And so she had this vision of how one would enter and exit the hospital. And if the exit includes death, the fact that the morgue is here, as she said it, and the chapel is here is quite intentional. You never would, in Maggie's vision, you'd never build just the morgue. I mean, it had to be the morgue related to the chapel, related to the exit. So again, it was built into her very vision of a hospital. Now, let me segue from that into a little thought about our context in the United States. For those of you listening who are from here, Of course, this would be radically different for those of you in other parts of the world. But in the United States, and I learned this quite by accident, so most hospitals, especially big hospitals in the United States, put their morgue in the basement next to the laundry and the exit for the garbage. And the way I learned this was from a pediatric oncologist at Duke's Hospital, who told me that one of the horrors of his life was when a young child died, and instead of the mortuary sort of carting the body away, the family would come collect it, and he would deliver the body to the family. He always had to do that at the exit to the morgue, which was right next to the garbage, and he always felt awful about that. And then he learned that the reason the morgue was right next to the garbage is that the hospital, one of Duke's extensions in the 1970s, they'd forgot to put in the morgue, so they put it in belatedly. But I was telling that story, I've never confirmed that story, but I was telling that to another doctor, and he started thinking about it and said, you know, I don't know that that's true. He said, it might be, but actually, if I think of American hospitals, I've never worked in an American hospital where the morgue wasn't right next to the laundry and the garbage. These are industrial facilities. We build them for efficiency, and technically speaking, bodies are medical waste. And so it's not surprising that we find a way for trucks to back up to the same loading dock for garbage and laundry as we do for hearse to back up for bodies. Now, let me jump again. So that's a lot to think about, actually. Imagine building American hospitals where we designed them around the morgue. But let me take it to a contemporary context, since we're still living in a world of COVID. So this is a picture from New York City last spring at the peak of New York's battle against COVID, when their system was overwhelmed, including their morgues. So these are all refrigerator trucks. Some of you will maybe remember pictures like this. Refrigerator trucks that were being used as overflow morgues. Statue of Liberty appropriately in the background for the theme here. This is one from El Paso, same sort of thing. And in also New York City, these are all the unclaimed bodies in New York at the peak of COVID last spring, where no one was identifying them or picking them up. So they just started burying them in mass graves. And all that was happening while this was the other problem we have in America, right? And those of you who pay any attention to us, if you live elsewhere, will have some sense of this. So just during the Republican convention, which is what this is a picture of, in the 4 days of August, over 4,000 Americans died of COVID, while all of these people were not wearing masks, with the exception of, I think, the 6 or 7 that you might find. Mostly the Republican convention was virtual, as were lots of things at the time, but there were some live in-person events. Here's one of them, and here's what we've been dealing with. And of course, what the problem we have in America is not just the fact that Republicans won't wear masks or that Donald Trump was president, and 70 more people just voted for him again. The deeper problem here that this picture represents is that we don't seem to know how to care for the dead. And as a result, the living aren't too sure how to care for one another. And I think that that's a lot for us to think about. And I want to leave you with that thought, and then just a couple more. So this is a closing thought about Maggie. It shows you the source of my title. This is the inner courtyard of Rama Hospital, right after you go through the main entrance where you would check in and start heading toward the wards. This is the beautiful scene that Maggie created when she constructed the hospital. And here you see her thinking about what the hospital really is in the light of her own sense of self as being the product of missionaries and the hospitals they built. Now, that could just be the end of the story, but there's a coda. And so here's the coda. So in 2015, the Burundian government seized all the assets of Maison Shalom and attempted to kill Maggie. Miraculously, in another long story I can't tell, she escaped. She ended up in Rwanda, where she's been living as a refugee ever since. And this is a visit I made to see Maggie, and this is the Mahema refugee camp on the border of Tanzania and Rwanda, just north of Burundi. When I was there, I forget exactly when, 3 or 4 years ago, it was 50,000 some people. I think it's actually grown now. Burundi continues to be a place to flee and not to live in. And what's remarkable about Maggie, when I met her now in Rwanda, and she'd taken Maison Shalom moved it to Rwanda and turned it into an organization that was no longer caring for orphans, but was now caring for all the Burundian refugees flowing into Rwanda from Burundi. What's remarkable about her is here too, she could only think about this biblically and theologically. So one of the things she started to realize several years into being a refugee, caring for refugees, was that this could go on for a long time. This could be like the Babylonian exile, which is really my next slide. So I'm a little premature on that punchline. I have to explain the quote at the top. The other thing that happened in 2015 when she became a refugee is that she met with the president, and it's the reason that she became a refugee. She met with the president, and twice she's met with him one-on-one. This was the second time. And she told me that the morning she had a meeting scheduled with the president, she opened her Bible, which is a common practice, and just sort of lets it open randomly and then has that be her morning reading. And this is the passage that it opened to that day. And this was the day she was going to meet with the president. And when she told me this story, she didn't have her Bible with her. We were in my house here in Durham. And she said, if I had my Bible, I'd show you the stains from the tears that fell on the page when I read this message, because I realized that this is what I needed to say to the Burundian president when I met with him, that I was becoming Jonah, and I was telling him that if he didn't change his ways, we were all doomed. And there's also a passage later in Jonah that in fact, he will be overthrown. Now, she never actually told him he was going to be overthrown. She was not formally part of the coup attempt against his life in 2015. She was a vocal critic of his regime insofar as he was causing more suffering of the people. I just realized recently, because I don't always keep up with her story, that in 2019, she and 33 other people who the president had decided had perpetrated the coup were tried and convicted of an attempted coup and sentenced to life in prison. So Maggie now is thoroughly someone in exile. In a strange way, the president died probably of COVID just this past June, 10 months ago. But nothing fundamentally seems to have changed with the regime in Burundi. And this is one of my favorite pictures of Maggie. Usually you see her in formal Burundian dress with a wrap around her head, but this is a different Maggie at the refugee camp. And again, this is where she's recognizing she and all of these Burundians may be in exile for a long time. And her goal now is to try to prepare the Burundians to come back to Burundi and turn it into the place she loves sometime in the future. So that's it for me. Thanks for listening.
My goodness. Thank you, David. That was fascinating and really moving. Your line about the living at the service of the dead, I think is a really powerful theme that I want to explore some more. And it also kind of brings us into the world of our next speaker, Father Stan Chu Ilo, for whom the ancestors are really important as well. Father Stan probably needs no introduction, but he's associate professor of Catholic studies here at DePaul, a native of Nigeria, and coordinator of our African Catholicism project, founder of the Canadian Samaritans for Africa, prolific author, several books, including A Poor and Merciful Church and Wealth, Health, and Hope in African Christian Religion, as well as a commentator for Huffington Post, Al Jazeera, and many other outlets. So we will move to a video of Father Stan's talk, but Father Stan will join us live for the Q&A session right afterwards. If you have questions for any of the speakers, you can go ahead and start putting them in the Q&A that you'll find at the bottom of your screen. So Father Stan.
Thank you everyone for the opportunity to address you. I'll be speaking on the topic, Rise Up and Walk. As far back as 325 CE, when the Council of Nicaea ordered that a hospital be constructed next to every cathedral to care for the sick, the poor, and the stranger. The church has been operating schools, hospitals, and outreach services to serve the most vulnerable from her earliest beginnings. Why is this the case? My presentation seeks to show why sickness, health, and healing are central to the mission of the church. Healing and helping to lift those who are down with sickness and all kinds of ailments is the vocation of all Christians. All Christians, Christian communities, and Christian agencies should find the most effective means for living out this vocation. It's not just enough to help the sick. Churches and faith actors must find the most effective way of doing this, because in some cases, some churches, some agencies have not done well, even though they mean well. Indeed, the word salvation, the Greek soteria, was not originally a term applied to religion. It was a medical term meaning to heal. The church exists to heal. This presentation is an attempt to contribute some thoughts from a biblical theology on health and healing to guide the ministry of churches and church agencies, Christians, and men and women of goodwill who are involved in the ministry of healing the sick and serving the most vulnerable members of our society in times like these. In this short presentation, I wish to use 3 miracles of healing in the Gospel of Luke to develop a theology of healing. Given the limitation of time, I will concentrate on 3 theological principles at work in these 3 miracles of healing in answering the following questions. Number 1, what does it mean to be sick? I guess all of us can answer that question because all of us have been sick, except if you are a superman or a superwoman. So this first question draws our attention to the condition of the sick person and how the Christian community is called to share in the suffering of the sick through solidarity. Number 2, the question of what the Christian community is called to do in order to share in the suffering of the sick through solidarity. Number 3, what then does it mean to be healed of one's sickness? Drawing our attention to the theme of this international conference, Rise Up and Walk. I might reframe this final question this way. What did Jesus mean by saying to the paralyzed man, rise up and walk? And how can the Christian community speak the same word of healing to the wounded and broken today? And finally, what are those attitudes and interpretations of sickness by the Christian community today, and some approaches to sickness, health, and healing in different parts of the world that might be interrogated through the lessons from the 3 types of figures that I focus on in this presentation? First, Jesus, the healer. Second, the crowd at the sites of these healing miracles. And finally, the sick persons, or those who are interceding to the Lord on their behalf. So the 3 parables I have taken are: 1, the parable of the healing of the paralyzed man; 2nd, the healing of the woman with the flow of blood; 3rd, the healing of the daughter of Jairus. Now, all these 3 healing miracles give us 3 lessons. 1, we learn the presence, the pain, and tragedy of human suffering in the face of sickness and death. We all know people who have died, people who are sick, even as we speak now. Some of us even listening, we have sickness, different kinds. So this is a human reality, and we find this in these parables. 2nd, the Christian community's interpretation, understanding, and response to human suffering, sickness, and death, vis-a-vis some false interpretations of sickness that we find in some settings who see sickness as a narrative of contamination. So if you got COVID, you're contaminated. You got HIV/AIDS, you're contaminated. You have Ebola, you're contaminated. People thought about it in the past of lepers, of the woman with the flow of blood. And so they might even start to blame people, those who are sick, for being sick. I know when HIV started, then people began to blame the gay community. So sometimes, rather than accompany the sick, we are really condemning them, questioning them, as if to say that their sickness is just the result of bad behavior. Sure, there are some people who take certain actions, risky steps that might harm their health, but we must look at the wider determinants of people's behavior. Why are they taking drugs? Why are they involved in these kinds of behavior? We cannot remove the environment, the social settings. We cannot remove the past, even social reproduction factors that bring it about. So sickness is not just one thing. And then finally, the Christian community has a vocation to accompany the sick and the dying in solidarity. Indeed, there is an African proverb from South Africa that really captures this. What the Christian community needs to do everywhere is umera asha, interpreted courage. Find courage and let us use your courage. So this means that there are times in life when someone does not have the strength to carry on. In those times, the community carries the person. The sick person will use the courage of the community. This is at the core of the Christian principle of solidarity, or the humanistic principle of solidarity. It is a theological principle that we find in the life of Jesus. So first, let us look at the person of Jesus as presented in these three parables as a healer. His healing ministry had a personal touch. He connected with the person's suffering at the personal level. By stepping into the pain of the sick, by immersing himself in their suffering, he was able to touch them at their pain points and offer the right remedy to those who came to him. In addition, it is worth noting that at the core of the healing ministry of Jesus was the affirmation and restoration of the human dignity of the person who is sick, respect of the person's agency, and deep love and connection with the sick. His attitude was that of a compassionate, caring, comforting, and supportive healer who accompanied the sick who came to him. Furthermore, he was concerned not simply with the healing of the physical ailment. His healing was holistic. He healed the whole person. Jesus located sickness within the wider social, cultural, economic, and psychological determinants of health. Finally, the healing of Jesus brought hope in the midst of human suffering and despair. Thus, his intervention was not simply a momentary response to human pain, like we find those who do medical intervention. They go in, stay 1-2 weeks, then they go back. They go back to the comfort of the United States or the big city. They go into the rural area. No, Jesus, he stayed the course. His was an interruption of a cycle of decay. His was a reassertion of the divine story into the human story. His was a salvific eruption of God's power to roll back the hand of death and defeat the forces of sin, despair, diseases, and evil. Central to the ministry of Jesus is what we find in the programmatic logion in the synagogue at the beginning of the ministry of Jesus. He says, "The Spirit of the Lord has been given to me. He has anointed me. He has sent me to bring good news to the poor, to proclaim liberty to the captives and to the blind new sight, to set the downtrodden free, and to proclaim the year of the Lord's favor has come. I propose that the healing ministry of Jesus was the concrete realization of the promise and purpose of the coming of the Messiah in history as God among us. His healing ministry was tied to his mission of saving the world. Through his healing ministry, he reveals his divine identity and models for us the interpretation, attitude, and response towards the sick for the community that he was constituting into the church. Now, let me show a few examples of how these general features and interpretation of Jesus's healing ministries are displayed in the three miracles of healing that I have chosen. First, in the healing of the paralytic in Luke 5:17, Jesus first does not go into healing. He recognizes that this man was suffering from a lot of social stereotypes. So he says first, your sins are forgiven. Why? Because during that time, the time of Jesus, people saw sickness as a result of punishment from God. So Jesus began with saying, your sins are forgiven. So without going into the complex debate he had with the Pharisees, the doctors of the law, and people from Judea and Jerusalem who were questioning Jesus, what Jesus did was he didn't believe that the man's sickness was caused by his sinfulness, because in many passages of the scripture, for instance, in John chapter 9, verse 2, people came to Jesus and asked him when they brought him a blind man, said, who sinned that this man was born blind? Jesus said, no, it's not his sin that caused his blindness. And then he went ahead and healed the man. But he knew that if he healed the paralyzed man and sent him home, what's going to happen? They would still be thinking, yeah, this guy is a sinner. So he first healed the man, forgave his sins before healing his disease. Now, we find in verse 18 of Luke chapter 5, a key text that says, and the power of the Lord was behind the words of healing. This power will later be affirmed by the crowd and the healed man at the end of the account. The recovered man at the word of Jesus rose up and picked up his mat and was jumping and praising God. A similar reaction we find in Acts of the Apostles chapter 3 verse 1 to 10 of the healing by Peter of the lame man who was begging at the beautiful gate. Now, there is a key text here because this is the theme of our conference. In both cases, Jesus says to the man paralyzed, rise up and walk. In Acts of the Apostles chapter 3, Peter did not say, rise up and walk. Peter lent him a hand. So in the case of Jesus, the word, rise up and walk, the paralyzed man jumped up. Peter was a disciple. So he had the power of the Lord, but the Lord wanted him to do it by touching the person, helping him to rise up. So the word hageiren, Jesus, Peter, in Peter's case, it was hageiren. Peter helped him to stand up. In Jesus's own, Jesus spoke life to the paralyzed man. Hageine. Now, what does that mean? It's an act of solidarity, helping him to stand, that Peter did here. In the ministry to the sick, we need to touch them. We need to walk with them. We need to help lift them up. In both cases, the healing ends with the affirmation that the healing of the sick is what God does when God intervenes in our human condition. Just like Peter said, in the name of Jesus, the Christ, the Nazarene, rise up and walk. Again, Jesus restores the dignity of the sick person. We find that in the healing of the woman with the flow of blood, the second miracle. This woman is considered as contaminated because he had a flow of blood for 12 years. This woman was a social outcast. She lived in the shadows. What happens when she came to Jesus is remarkable and fundamental as we develop a theology of healing, of sickness, and of health. To be noted to begin with is that when we touch God, we do not contaminate God. When we come in contact with God, God touches us deeply and heals what, by human terms, may be perceived as contaminated about us. God does not see any of us as contaminated. When Jesus felt power go out of him, he knew that even though this woman came secretly to touch him from behind, that a truly intimate and transformative exchange had occurred between his divine power to heal and restore and the human weakness and vulnerability and the desire for healing that came from faith from this woman, a courageous woman who broke the barriers. The crowd surging around Jesus, this woman did not care. She elbowed her way through to find Jesus. Just think of the response of the crowd also in the third miracle of healing. The crowd, in this case, saw a woman who was sick. They couldn't let her in to see Jesus. In the case of the crowd, in the paralyzed man's case, what do we see? The crowd again will not let his friends bring him in, so that they had to climb the roof of the house to bring the paralyzed man to Jesus. How many times do we find these kinds of obstacles? The way we treat the sick as if they say they're expendable. The man in the third miracle, Jairus, the messengers came to him and said, "Oh, your daughter is dead. Why bother?" He never gave up. How many times, even in this COVID-19, have we given up on some people? And how many people are dying in this COVID-19 because of poverty in their countries? Because no one cares. In the case of the woman with the flow of blood, Jesus says to her, Jesus does not call her a stranger, a sinner. Jesus calls her my daughter. Your faith has restored you. Go, be healed, go in peace. Like in the case of the paralyzed man, there was an exchange here. Jesus, this woman moved from being an unknown woman without a name, without a history, who was carrying a contagion, alienated, rejected, and abandoned by society, to being now affirmed by Jesus as my daughter, a child of God, a member of God's family. Here, Jesus now associates himself with this woman and confers on her a new identity, restores her dignity, and gives her a new mission when he says to her, go in peace. This affirmation, my daughter, go in peace, is actually a very missionary mandate in scripture. We remember the missionary mandate given to the 12 in Matthew 28. Go out to the whole world, proclaim the good news. This is retained in the Catholic liturgy today. At the end of the Mass, we say, go in peace. And whenever we hear that, whenever I say that at the end of the Mass, I remember this woman who came as someone with a contagion, who's contaminated, a social outcast, who is now healed, restored to humanity, restored dignity, and then given a new vocation to go. So we find some principles here by way of conclusion that I think we can think about. The first is the community of faith, which continues the mission of Christ here on earth, must commit herself to holistic healing by actively getting involved in the lives of the sick, understanding the nature of people's sickness, entering into the world of the sick, particularly focusing on the wider determinants and other determinants of health, and offering hope to the sick by giving an interpretation of health sickness and healing that reflect this holistic understanding of sickness, health, and human wholeness. A theology of health and healing must also develop the suitable ethical response and practices that will be driven by compassionate accompaniment that must constantly question the adequacy of our health systems and healthcare services in bringing healing and hope through this holistic healthcare. This requires going beyond episodic medical intervention, prevention and treatment of diseases, building of hospitals and therapeutic measures to addressing why do people get sick in the first place, the environment in which they live, and the social conditions of the people. Sometimes we're dealing with symptoms rather than dealing with the root cause of the disease. And these root causes of disease is what many people call today the social determinants of health. They are the causes of the cause of diseases today. In addition, greater emphasis must now be given to some of the wrong interpretation of sickness, especially infectious diseases like COVID-19, Ebola, HIV/AIDS, the prevalence of or origin of which have led to the stigmatization and stereotyping of people like Asians because of COVID, or Africans because of HIV/AIDS, or gays because of HIV/AIDS. So we must move beyond this stigmatization of individuals who are sick to understanding that in their sickness, we also find our own human sickness, our own global sickness, particularly with regard to gender issues. In Africa, a lot of women are often stigmatized, like the woman in the story, condemned as being witches or blamed for causing the deaths of their husbands or lovers, and subjected to all kinds of rituals and social ostracization. This blame and bitching of the sick, particularly women, which often leads to subjecting people to all kinds of Pentecostal and charismatic exorcisms and violent healing sessions in many parts of the world, require a greater and deeper theological penetration and critique so that we understand why people are sick, what they are sick of, and how we can accompany them using the paradigm offered by the Lord. Finally, the message for developing a theology of health and healing is that of hope. A lot of people we find in these healing miracles, the crowd, some of them were despairing. The paralyzed man's friends become for us a model of how Christians, we should become friends of the sick. We should not give up on those who are suffering. The image of the church as a field hospital used by Pope Francis comes to mind here, both in a metaphoric sense, but also in a proper sense. The church's healing ministry, however, must go beyond building hospitals or running clinics, but also to health promotion, paying attention to social and health policies in local and global settings, addressing the challenges of hunger, of injustice in the world, of poor water and sanitation, of poor housing, of environmental degradation and climate change. We can contrast the attitude of the paralytic's friends and that of the crowd, the Pharisees and the scribes. They turn the sickness of this man into a theological question. So people spend time doing conferences talking about the sick and not going really doing the job. Sometimes we spend time in churches talking about what we should do. We need pragmatic solidarity, action. So we are more concerned, sometimes even here in the United States, about finances, Obamacare and all those kinds of healthcare policies, in a libertarian contractual notion of healthcare rather than a collectivist approach. You will have people who are more concerned that the sick is just about the agency of the sick. They have to take care of themselves. They have to lift themselves up by the bootstrap. We forget that some people have no boots. And those who have boots, they don't have straps on their boot. So the message here is also that we do not give up on the sick, the elderly. Like the paralyzed man who was dying, his friends could have given up on him. Like the woman with the flow of blood, her family abandoned her. How many elderly and terminally ill people are feeling this abandonment today? Even we have a movement now of euthanasia, you know, that you have the right to ask to be, you know, to put an end to death, but I mean, put an end to your life. But what I'm saying here is that there are those who become gift to us by who they are, what they bring to us. But there are those, and that's the sick, the elderly, the terminally ill, who become gift to us by what they teach us about our humanity and what they bring out of us. That love that is the real and true human essence, and that is also the divine essence. The sick must be loved until the end, because Jesus says during the Last Supper that he loved us to the end, from conception to natural death. So finally, we might think of the three things that can help us by way of conclusion. First is that the church and Christians everywhere must fight growing health inequality in the world and in particular societies. We must fight this rather than just be dealing with control of diseases and treating those who fall sick. We must take a bigger and larger picture like Jesus did. The second is a renewed ethics of care, compassion, and solidarity. That's what this theology shows. We need to recover a collapsing sense of compassion in the world, where people are fighting over vaccines and fighting over treatment, and one part of the world is getting well treated, the other is neglected. Here in the United States, the people of color, African Americans, are disproportionately affected by COVID-19. So we must fight growing inequity in healthcare. And finally, we know the future is uncertain. In this pandemic, we don't know when it will end. The church must rethink her current model of healthcare, health intervention, and health systems. Yes, prayers are good. That's how the church have accompanied society in many phases during the 16th century plagues or the 19th century outbreak of cholera and the flu. We pray. Now, churches are shut now here, churches are open there. We need to rethink, because the future we will have to do for the next 30 years or more, you know, different infectious diseases will be emerging that will threaten the health of millions of people across the globe. So the major challenge that I leave for you is, how do we combat these infections? Especially because we don't have specific treatment or cure, or vaccines. We have vaccines, but we don't know. There is limited scope now for preventing or controlling diseases. This is why we need to stick together as one human family, caring for one another, searching together for answers to these new problems. It's not beyond our capacity. Our faith becomes that tool that tells us that we can never lose hope. And I think on that note, let us move ahead with hope that we can heal a broken and wounded world. Thank you.
Well, great. Thank you so much, Stan. That was a really powerful talk. And I think in a lot of ways, you've really underlined some themes that are at the core of all three of the talks this afternoon. The idea that sin does cause sickness, but it's not the sin of the sufferer, it's the sin of the system, the kind of structures that exacerbate and cause sicknesses. It kind of brings to mind what Helder Camara said, famous bishop from Alex's home country, right? When I feed the poor, they call me a saint. When I ask why the poor have no food, they call me a communist. And you could make that same sort of statement when, when the church attends to the sick, they say we're saints. And when we ask why people are sick, the reaction is more negative. And you've also pointed towards the answer to this, and I think all three of the talks have pointed towards the answer in solidarity and receiving the gifts that the sick have to offer, and receiving the gifts that the dead have to offer as well, as in David's talk. So thank you, all three of you, for those beautiful interventions. And so I'm going to ask everybody in the audience, if you have questions, please put them in the Q&A, and we'll have a discussion. We've got a few questions in the Q&A already, so I'm going to go ahead and put those out. The first question comes for David, and this is from Susan Nedza. As an ER doc, I often asked why we didn't have a place for those likely to die in our trauma center. The bodies were stored in a converted closet in which families visited before the bodies were taken to the morgue. Do you know of any facilities that have built any co-located spaces between the ER and the morgue?
I don't, and not that I've tried to really dig into that, but I do know that whenever I've given a talk like this and have had American physicians in the audience, they all immediately realize that I've described one of the problems with American hospitals. So they may well exist, but I haven't encountered, nobody's told me of one.
Okay. Great. Well, this is the next question is for any of the speakers to respond to from Sister Mary Jo Stein. How can we motivate parishes and other church groups to participate in healing and health promotion as suggested by all three of you?
Let me take a stab at that answer, but turn it into a question for Alex, or for that matter, Stan as well. But I wrote down a question for Alex when he was talking. So the only way I know how to talk about that is to talk out of my own experience. And that's, so I went to Africa for work originally, not, I wasn't, the stuff I got caught up in was unexpected, but I remember one of the early trips, I was with Emmanuel Katongole at the leadership conference that he was starting at the time, and we were in Burundi. There's 75 Africans in the audience, a few folks from the West and global North, mostly the Africans. And there was a guy from Congo standing in front of the room, and he was describing what was going on. This was 2009 again. So he was describing what was going on in Congo, which was horrific by every measure at the time. And he was right on the verge of tears. And when he sort of was finishing his talk, almost breaking down by the horrors that he was seeing and living through, he said, "Come and see, please come and see." Now, I didn't actually go to Congo for about 2 years after that, but those words kind of hung in my head. And what I realized later, as they sort of bounced around in my brain, is that those are Jesus's words. It's when he's, I think it's when he's calling Andrew and Peter, and he says, it's something that they say they're following behind him, and he spins around and says, "What do you want?" And there's this exchange, and he says to them, they say to him, "Where are you staying?" And he says, "Come and see." And my own experience has been that that's what has gotten me motivated, is opening myself up to hear those words coming, like, "Hey, just come and see," and then going to see. And then having seen, you get sort of pulled in. But here's my question for Alex. That for me was ending up in Eastern Congo because someone had said I needed to come see. And I also ended up in Sudan because someone told me I needed to come and see. And I ended up in Burundi because someone told me I needed to come and see. Of course, there's a lot going on in my own neighborhood that I'm probably not seeing and I'm not coming to see, right? So in the language of Michael Ignatieff that I like a lot, like what my tendency is to go see distant strangers. So the preferential option for the poor for me oftentimes pulls me into the world of distant strangers. And I'm wondering, Alex, in the way you described things, how do you think about that theologically with this preferential option for the poor, when in fact the poor are always both close and far? And we live in a world where often we find ourselves, well, now speaking for my own self, like I get pulled to the ones who are far, not into the ones who are close. And I'm wondering theologically how you even think about that distinction, or if it is a distinction, and how one navigates it.
Thank you, Dave, for the question. And thank you also, I forgot the name of the person who asked the question first. Sorry for that, about how to motivate.
Sister Mary Jo.
Sister Mary Jo. Thank you, Sister Mary Jo. So first, I would connect what exactly to answer the Sister Mary Jo, then I'll talk about Dave in the preferential option for the poor. I think Dave shows something it's important and help us to motivate the other is experience, witness. If in your community, you or somebody's already doing, show your experience. Show your experience and in how your actions or action of those who do it is inspired in the gospel, led by the Holy Spirit. And show that I always think to motivate people as Christians and disciples of Jesus, we have to show the joy that is to be a Jesus disciple. That's not something I put in my shoulder and I am tired, I am suffering, I'm struggling to do that. Of course, we are human, we get tired, we get sometimes sad because frustrations or things. But at the same time, I have the joy and I feel as a privilege to be a Jesus disciple and show that in our communities. And every time come a new person or the person is there every day in that bunch, come to the mass, come to the community, and then sometimes you don't see that person. And the mass is sad and thinks it's boring and thinking you don't show the joy of to be a Christian is, or ever in, and I'm not saying to show that joy should be like my style as a Brazilian, that we dance, we jump and say, no, that's every culture have the way to show the joy. Some countries show the joy in a more reserved way, and that is fantastic as far because the community respond to that joy. I think in a way to show that joy is by witness. Every time I talk to community, I work in Brazil many years with grassroots communities that serve to the sick. Humble people, most low-income people serving another humble, low-income people. And every time I talk and provide some training, even some like tell about healthcare and issues, how they can advocate in the Brazilian public healthcare system, I was trying to show how we have a privilege to do that, led by a God that is with us in history. It's not like only in the heaven tell you what to do, but they're walking in history. I think that, I don't know, maybe for me, that's how we help me to get motivated and still today. Show, Pope Francis said, the joy of the gospel is one of his texts. Show that to serve the sick, follow Jesus, it's a joy. It's good. It's beautiful. And people, you get motivated. They will feel that holy spirit that will guide them. As David said, come and see. Like, it's a joy. About the preferential option for the poor. Oh, another thing I took notes here to connect to the Dave's talk. And with that, motivates people imagination. That healthcare, because Dave talked about the word like the Imagine create the swimming pool, they create theater. That's all healthcare, social determinant of health. They create is a foster imagination of children, of teenagers and young people and others. It's very important. And when you create that joy of the gospel, foster people's imagination, how they can be creative and find ways to serve the sick, to save society, to promote well-being, to promote population health. The gospel, it's beautiful because when you get interacted, it's a work of imagination, like working to feel, to dream with a new society. And then you feel excited to work for that new society, to build that. I think it's great. And I love all those projects that use arts or other elements of culture to attract young people, to foster imagination, because that's very important to promote health, to promote well-being, and to help people to have dreams, to aspirations, to great things in life. And very short about the offering for the poor, they said, I see option for the poor, first of all, as a commitment in a lifestyle. And that I learned reading the writings of Bill Colt, Don Elder Cameron. Don Elder Cameron, in the Vatican II, he gathered a group of bishops, many from Latin America and some from Africa. And then they wrote a document that's not much known here, but very known in Brazil, called the Catacomb Pact, Pact of the Catacombs, because that was a meeting in a catacomb in Rome. And one of the things, all those bishops commit themselves and they go back to the countries, the diocese, to live in the same way the people in the diocese lived. Jesus led Don Elder Cameron to the first thing to do in his bag is take the ring, those rings the bishops have that expensive, take those ring and give to the poor, sell, take the money, buy food. And then he starts to use a ring like this I use here, like it's a coconut ring that has no value, you can find anywhere in Brazil. And that became a symbol. And I started to use that when I was 13. And I use until today as a symbol of the preferential option for the poor is a commitment. That I don't only use that in a theory, things I write or some projects, but I try to embody that 24/7 as a humble life and with every person I encounter in every situation. And that seems trying to create like a sensitivity that you can see any moment. Be attentive to people's need here, far, anywhere. I think that's a way, I would say that is my witness to trying to answer. Remember that option for the poor is a commitment that starts with your own lifestyle. In that sense, to remember you to be sensitive to people who are near to you right now, but also the suffering of people you don't see the faces. But when you see the numbers of death of COVID-19, you're trying to make an intentional effort. Those numbers, behind them are faces, are stories, a narrative, and then those things matter, and I want to commit to them. And if I have opportunity to go where I can see those people, enjoy and walk with them, in, as Father Stan said, in solidarity.
Father Stan?
Very fascinated by what Alex was saying. So I'm just kind of transported by that witness, as well as the witness of David. I think there are three important points that always have stayed with me as an African. And one is 2 weeks ago, I spoke with the nun running a hospital in my town, a Catholic hospital. And so when Dave was talking about the morgue, it kind of struck me, not in that wonderful design of Maggie, but in a very painful way. Because the nun said to me, the only thing working in this place now is the morgue. I said, why? He said, we don't have anything to treat the sick. And so, but at least we have a morgue where we can keep them, take care of them until their families are ready for the funeral. I know that Katongole had written in his book about the church and coffin paradigm. It becomes even for me the thing that a Cameroonian philosopher, Achille Mbembe, calls the necropolitics that is generating these structural sinful reality. And so the prophetic denunciation of these structures or witnessing and creating an oasis of hope like Maggie is doing and many other prophets, they serve for me as a sign, an advanced sign. But at the same time, I am also, in terms of the question Sister Mary Jo asked, I'm also worried that these are a band-aid solution. And the other band-aid in terms of what parishes are doing is that there is this devotionalism, this transactional nature of God, that people are pouring prayers upon prayers for healing. Healing ministry is the thing that is growing not only in the continent of Africa, but also most of the global South. You know, from the conference we had at the Center on Pentecostalism, most of this prayer, and then you have small intervention. But there is a cycle of decay that I think the Christian community must now develop a critical, reflective, prayerful solidarity that goes beyond simply praying and anointing the sick, that goes beyond small efforts that might be seen as the sign of what is to come. My question to my co-panelists here and to the rest is, without, and I think Bill, a very important work that you're doing in your own studies and writings, without a political realignment, without politics, I think when it comes to health locally or globally, we cannot rely on prayers or individual effort. They are good, but they are only temporary. If you do not institutionalize a practice at the political level, if you do not institutionalize a practice in the church, this parish priest will want to be prophetic, but the bishop, if the bishop is not interested, he will clamp down on these things. So how do we really, the church and Christians, how do we take a political stand or political project to change? For instance, in Africa, it's like one step forward, 4 steps backward. I mean, look at Maggie. She started in Burundi. She's ended up in Rwanda. Now you're going to have a new, whenever Paul Kagame steps down, and the fear that there might be chaos, given what the kinds of political system that is going on that people don't see, then you might have a Hutu president who will now chase Maggie now to Uganda. So that's my concern, is really without politics, without change in our politics, speaking of Africa, without change in this political system that we see that is producing necropolitics, killing of people in their numbers, where is the hope?
So if I could jump in, we've just got 5 minutes left, and there are some questions on the chat. So I want to get to those. People have patiently waited to have their questions addressed. So I'm just going to put these questions out there all at once, and then you all can respond in the last few minutes that we've got. The first one is from Dr. Sam Orak to David, and kind of has something to do with what Stan was just talking about, asking how have the higher ups in the Catholic Church dealt with Maggie Baron-Kitze. He said his impression in the Vatican was that they appreciated what she was doing, but kind of felt like it ought to be done by them. So the question is, how are the kind of higher ups receiving Maggie's work? Question from Stan Okonkwo asking, was the swimming pool the people's idea, or was it Maggie's idea? And given the water shortage in Africa, how did that go over? And then there's a final question from Equiodosor. There is an equity issue in the Western approach to dealing with the sick and poor in our societies. Why is it that epidemics or pandemics which arise from the so-called third world do not attract the same level of empathy as those that emanate from the superpowers? So in the 3 minutes that we have left, go ahead and deal with those.
I'll do quick answers to I was thinking, I saw Sam's question come through, and I was thinking of at the same time what Stan had said. So I do think they're connected. So just yeah, Stan, I take on board everything you said. Yeah, where's the hope, right? I don't know. I mean, this is one of my experiences as an outsider who keeps dropping into Africa. Like it just seems to go on and on. But if I concretize that with Maggie, I mean, so Maggie was always inherently political. And I think that is an answer to Sam's question. The church, as far as I know, has been on again, off again supportive of what she's done when she was really still in Burundi doing it. I mean, they're supportive. On the other hand, she is constantly taking on the bishops. I saw Sam's question come in early, so I sort of looked up and found a quote from her, and she says, "I do challenge the bishops, especially when they hesitate to act for those who are in need, children, mothers who are suffering, refugees returning home who've lost everything. The church has land and it has resources, so I challenge it to act. So I do not always agree with the diocese about priorities and about what we can and must do." And she, I don't have time to tell, but one very brief story. But so she challenged the bishops, right, to do what they could do. That doesn't always make you popular with the bishops. And so one time she asked the bishop for money to give the children new clothes for Christmas. This is when she just had a few hundred, and he refused, but she knew that he'd just put new curtains in his house. So she snuck into his house, took down his curtains, gave them to some seamstresses. They sewed all the children new clothes. And then she tells two different versions of the stories, which I realize now has to do with trauma, but one of two things happened. She then took all the children and put them at mass on Sunday in the front rows of the church so the bishop could see that they were wearing his curtains, but he didn't notice. Or she took them to a Christmas party in his clothes where someone else noticed the curtains were gone. I'm not sure which one actually happened. But eventually there was a nun who told on her, and the bishop called her in and said, "You stole my curtains." And she said, "No, I didn't steal your curtains. I asked you for clothes for the children and you gracefully provided them. Thank you very much." She's done a similar thing with land. She's asked bishop for land for returning refugees. He said, "No, I've got land, but they can't have it." So she went to the refugees, said, "Start farming that land." Then the bishop came to her and said, "You've got people farming my land." She said, "Yeah, well, I asked you for land. They need land." So she's doing that. And then in terms of why she's in exile, she was leading protests in the streets in Bujumbura before the coup attempt. She wasn't part of the coup attempt, but she was leading protests in the streets against the regime with the people because of the fact that he was imprisoning more and more people. So I think she's inherently political and tries to change things at that structure. But as you've said better than I can, I mean, it's an uphill battle. The swimming pool, if you dig deep enough with Maggie, what you find is that many of the ideas she had came from the children. It's in conversations with the children that she got her imagination for almost everything that she built. So I don't know exactly what the swimming pool, but my guess is it came from the children in addition to her own theological insight. I'll stop there.
Very quickly for the question about why the epidemics and things happen before, like COVID, never get traction in the global north. And I think the answer for that is very straightforward. Is prejudice, racism, colonialism, history. It's when you think about from a Catholic social teaching, is a perspective that people who are in position of power, especially in the global north, they don't see people with low income, poor, from poor nations, different color, with the same level of dignity. So they don't give the same attention. It unfortunately is that I experience that all the time. Like, for example, here in the United States, when I'm here, when people simply treat something, for example, I wrote in Portuguese as necessarily worst than something that's written in English, but they never read the Portuguese version because they didn't know Portuguese and they refused to learn. Why that is, although Paulo Freire said that oppression in the minded, only the poor people can liberate not only themselves, but that oppression that is already inside and circulate in the mind of the oppressor. So that's the answer. And Bill, just 1 second. You know, my mom is watching here, and she doesn't know one single word in English, but me come from, my parents never went to school, just to give you an idea. They feel so proud of the son speaking an international conference and listen them in English. I just to say hi to her in Portuguese, if you allowed me.
Please do. Go ahead.
Mãe, obrigado por assistir. Beijão para a senhora e para o papai. Te amo. Tchau, tchau. Thank you.
Oh.
Yay.
That's wonderful. That's a wonderful way to end this really rich session. Thank you all so much. This was really terrific and gives us so much more. I wish we had more time to talk. Our next session is at 4:30, David Cayley's keynote speech. So we'll see you again soon. But please join me, everybody in the audience, with giving a heartfelt thank you for our 3 panelists. Terrific job.